Hello, my name is Annie, and I will be sharing with you information about the cardiovascular system. I'll be going over the structures of the heart, its functions, and the mechanics of how the heart pumps blood throughout the body, which includes the pathways of the blood, as well as some diseases or complications that are associated with cardiovascular systems, as well as some treatment options or drugs that can be prescribed to help treat cardiovascular diseases. First of all, let's take a look at our main character, the heart. Now, the heart is surrounded by a double-layered pericardium, which in turn forms the pericardial sac. The outer layer is known as the parietal pericardium, and the inner layer is known as the epicardium. Between these layers resides the pericardial fluid, which aids in a type of lubrication for the heart that allows the heart to smoothly contract with each heartbeat. The myocardium is the muscular layer of the heart and is the mechanical driving force of the heart's ability to beat for us on a daily basis. These muscular contractions are dictated by electrical impulses. And as you can see, the left ventricle has the most myocardium surrounding it so that it has enough power to push all the blood to the whole body. But before we continue, let us visit the four major chambers of the heart: the right and left atrium, which are located at the top of the heart, and the right and left ventricles at the bottom section of the heart. Each chamber is lined with endocardium, and you can also see that the valves that control the flow of blood through the heart. The way I remember, this is the way I remember it. It's always try before you buy a product. And so the tricuspid valve allows the blood from the right atrium to flow into the right ventricle as the myocardium contracts. These same valves also close to stop blood from rushing back up and into the right atrium. The pulmonary valve then allows blood to leave the right ventricle so that the deoxygenated blood can travel to the pulmonary arteries and travel to the lungs to be reoxygenated. And then the reoxygenated blood returns to the left atrium, and then the bicuspid valve, or also known as the mitral valve, opens to allow the blood to flow into the left ventricle, where the heart beats yet again to release the oxygenated blood through the aortic valve into the aorta and through the superior and inferior parts of the body. If we talk about the heart, we cannot forget our very own conductive or conduction system. The sinoatrial node, or also known as the SA node, which can be considered to be our very own natural pacemaker, is positioned posteriorly in the right atrium. The SA node initiates the electrical impulse of each heartbeat. Muscle cells within the myocardium then respond to this electrical stimulus by contracting both atria, and the impulse travels down to the atrioventricular node, also known as the AV node, which is located in the lower right atrium, and the signal continues down the bundle of His, which is located in the septum of the heart, which separates the right and left ventricles. And also the bundle of His separates into their each respective branches, and they end with the Purkinje fibers that are within the ventricle walls. And as you can see, the pathways, 8 arteries distribute oxygenated blood throughout the body, and the veins carry back the dark deoxygenated blood towards the heart and lungs so that they can be reoxygenated and pumped back into the body to distribute the much needed oxygen throughout our bodies. And also moving on to some complications or diseases that are present within the human body or can be present within the human body. I just wanted to name a few concerning the heart, the arteries, and the first one I wanted to look at was the mitral valve prolapse, which can be congenital. It can be a congenital condition, or it can also be caused by a traumatic damage done by an infection, obviously to the the bicuspid valve. And this damage can only be corrected through a valvoplasty or valve replacement surgery. And the next disease is pericarditis, which results from an abnormal buildup of pericardial fluid, which can compress the heart and inhibit it from pumping blood to the body in an efficient or regular manner. This can also be referred to as cardiac tamponade. This condition can be treated with either an antibiotic drug or pericardiocentesis, where doctors can extract the fluid buildup from around the heart or from the pericardium to allow the heart space to beat normally again. And then an aneurysm is a result from weakened artery walls that lead to dilation of an artery that can rupture without warning in any part of the body. A particular type of aneurysm that I chose to look further into is a dissecting aneurysm that actually tunnels between layers of the artery wall, which leads to the separation of the atherosclerotic plaque within the artery wall and distending the artery dangerously until it ruptures. However, if you are able to catch an aneurysm before it gets to a dangerous situation, you can undergo an aneurysmectomy, which is the removal of an aneurysm and repair and get the chance to repair the affected artery. And moving on, I wanted to look at hypotension. We hear a lot about hypertension, which is increased or elevated heart, blood pressure, but hypotension is characterized by blood pressure readings of lower than 90/60. And this can lead to orthostatic hypotension, where when you are in a lying or sitting position, if you get up too suddenly, you experience sudden but temporary plunge in blood pressure that can lead to lightheadedness for a few moments. And I know in recent days, a lot of people are saying, oh, it's because I'm low on iron, but potentially, you might have hypotension, and that drastic change in positioning might lead to your blood pressure just dropping drastically, just enough for you to feel that lightheadedness for a couple seconds. And then the next one is bradycardia. It's a type of arrhythmia that results in a continuous slow heart rate that can be corrected through anti-arrhythmic drugs, or even possibly through a pacemaker for more serious cases. A pacemaker implant corrects bradycardia by assisting the heart with a more regular electrical impulse to encourage the heart to beat more regularly and at a more acceptable heart rate. Asystole is a term used for a complete absence of a heartbeat, which can also be called a cardiac arrest. And the only way to resuscitate the patient during asystole is to perform cardiopulmonary resuscitation, or more commonly known as CPR. And following, I just wanted to include a couple of drugs that can be used to help cardiopulmonary disease patients, and also a few more treatment plans that can also be used for individuals that are suffering from cardiopulmonary disease. And the first one that I wanted to point out was anticoagulant drugs, which prevent blood clots from forming in patients that have risk for arterial sclerosis. And as the name implies, anticoagulant drugs prevent, blood clots from even forming, especially very helpful for individuals that have increased amounts of plaque within their arteries or veins. And so anticoagulant drugs help the blood to freely flow without creating more obstructions within their veins or arteries. And also beta blocker and calcium channel blocker drugs. They both treat angina pectoris, which is just chest pains resulting from abnormal heart activity or hypertension. The beta blocker decreases the heart rate and helps to dilate the arteries by blocking the beta receptors. And the calcium channel blockers inhibit the calcium ions, from moving into the myocardial cells and helps to decrease heart rate and the blood pressure for individuals that suffer from high blood pressure. And then the next, this is a treatment that can be done, is the cardiopulmonary bypass. And this procedure, it really isn't a treatment, but it is type of a technique that surgeons use during open heart surgery. And surgeons reroute the patient's blood through a heart-lung machine that oxygenates blood and filters carbon dioxide and waste products from the blood before being pumped back into the patient's body. And this machine effectively aids or takes over the functions of the heart while surgeons operate during an open heart surgery. And the last thing I wanted to mention was carotid endarterectomy is a procedure that removes plaque buildup within a blocked aortic artery. This procedure also helps to alleviate carotid artery stenosis due to plaque buildup. And stenosis just signifies that the arteries are undergoing a narrowing, which usually is due to plaque buildup or just blood clotting and creating an occlusion or an obstruction to the arteries in question. And in this case, this is talking about the carotid artery. And these are just my references, and I hope I was able to supply you with some additional information about the cardiovascular system. And hopefully, this will raise a little bit of awareness about our heart and how it functions. Thank you.